welcome to this week's edition of 3 Healthcare Headlines You Need to Know from Tallahassee. My name is Fraser Cobbe. I have the great pleasure of working with a number of medical associations across the state, and this is going to be our weekly opportunity to connect our members with what's going on in Tallahassee. I want to also introduce my co-partner here, Joe Daraskevich.
Fraser, yeah, I'm Joe Daraskevich, and I work alongside Fraser, like you said, with multiple societies and organizations. So it's just a pleasure to be here today.
Terrific. Thanks, Joe. As you guys know, we started legislative session here in Florida this past week. So this is going to be a way we can connect with our members to give you the information you need so you stay on top of what items are being debated in Tallahassee and how that might impact the practice of medicine and the patients that we serve. So each week, look for Joe and I to do a quick summary of all those happenings. And if you ever have any questions, don't hesitate to reach out and ask for more information. So Joe, why don't we dive right into what our members need to know this first week of session?
Yep, busy week. Things are getting started. First on the list, we're talking about Speaker of the House Paul Renner endorsed the Senate President's Live Healthy proposal. Fraser, what's that all about?
Yeah, the Senate president came out with a robust proposal called Live Healthy to address workforce issues here in the state of Florida, to make sure that our physician and other healthcare provider workforce keeps up with our growing population. So there's a number of items in there that we've been pushing for many years, including expanding access to GME programs, residency program funding here in the state, as well as providing more money for loan forgiveness. And reducing some of the barriers to licensure, those unnecessary barriers that won't compromise quality care and the level of professionals we have practicing here in the state, but will open up avenues for more clinicians to move to the state of Florida and make sure we are keeping up with our population growth. So with the Speaker of the House endorsing the Senate President's in proposal as well, it really paves the way for this bill to steamroll through the process. It has already cleared 2 committees on the Senate side, and actually, as we're taping this, its first committee in the House is hearing it as well. So there is a 100% chance, well, I shouldn't say 100%, 99.5% chance that this bill is going to pass in some shape or form. And the FMA and all of organized medicine is making sure that we support this legislation, the good measures that are in it, and make sure that there's no scope of practice creep or other issues we may have that might compromise quality care here in the state of Florida.
Okay, that's a pretty high percentage. Not quite 100, but 99%. That's heading in the right direction.
Yeah.
And our second, and obviously we'll be keeping track of that as it goes on. Like Fraser said, as we're taping this, going through these different layers of approvals. But we'll keep you guys updated on that as the weeks go on. Second topic this week, Fraser. Both chambers definitely hit the ground running. That's for sure. The meaningful prior authorization reform legislation has been filed in the Florida House of Representatives and in the Florida Senate. Fraser, you want to dig into that one a little bit?
Yeah, the last several years, prior authorization hassles are like the #1 thing that our members complain about, the amount of time and resources they expend trying to get approval to render care to their patients and jumping through the hoops that are put before them by the insurance carriers. So for years, we've been seeking more transparency and accountability on these prior authorization reform measures. We are excited to have legislation filed in both chambers. This is a collaborative effort with the Florida Hospital Association, the Florida Medical Association, and all of organized medicine. Again, our goal is transparency when these authorization procedures are put in place, and accountability. There's some measures in there that require insurance carriers to be transparent with their insureds about what processes are in place, and if they are going to make decisions to either approve or deny care, medically necessary care requested by their treating physicians, that they do so in a timely manner. So there's some time frames for responses in there. And then it also includes one issue on retroactive denials that has been a thorn in the side of physicians for a number of years. They go through the process of all these hoops for prior authorization to get finally approved to render the service. They do so in good faith, and then 6 months later, the insurers come back and claw back that money, saying the insurer was not eligible after all. So this bill, there's language in there that would permanently end that practice. So definitely a good bill. It's going to be an uphill climb just because it's difficult to pass meaningful insurance reform in Tallahassee, not just in healthcare, but across the insurance spectrum. But we are excited to continue this dialogue, and hopefully we're taking another step in the right direction this year on it.
Yeah. So it sounds like the first topic we talked about things. Everyone's kind of rubber stamping that and kind of moving through the process. This one's going to be a little bit more of a challenge, but again, we'll be keeping an eye on this as the weeks go on
Yeah.
with all kinds of updates
Yeah.
from Tallahassee.
Yeah, and what I would add, Joe, is our talking points on prior authorization kind of dovetail nicely with Live Healthy, right? Because if we're going to not just encourage physicians to get here, we have to improve the climate for practice here in the state of Florida as well. So if physicians aren't able to do the things they need to do to treat their patients, to have a good professional experience here while they're practicing the state, we're going to struggle to maintain a good, strong physician workforce as well. So I think the two issues play nicely together, and hopefully the legislative leadership feels that as well.
Yeah, that's pretty important. Our final topic this week, Fraser, the Senate Banking and Insurance Committee approved a bill to increase physician reimbursement in workers' compensation insurance. Was that something that was expected? And what happens from here, Fraser?
So that bill is something that the physicians that treat injured workers in the state have been pushing for a long time. It's not widely recognized, but Florida is the lowest state in the country for physician reimbursement in workers' compensation. Because of that, we have some of the lowest participation rates for physicians actually treating injured workers. Those specialties that have to participate in workers' comp due to the nature of what they do, for instance, orthopedic surgeons, they still muddle along and deal with the workers' comp system, even though reimbursement, again, is the lowest in the country. That reimbursement structure hasn't been updated in 20 years. It's tagged to Medicare, and as we all know, Medicare has flatlined physician reimbursement since that time. So actually the value of its service in workers' comp has gone down over the last 20 years, and it has not kept up with the cost of rendering that service. So again, our participation numbers in the state speak for themselves. We think it's time to reinvest in access to care for injured workers. Injured workers, of course, give up their right to sue their employer if they're injured on a job with the expectation that they're going to get good quality health care that's going to restore them to function. And we think by expanding or increasing the fee schedule, more doctors will be willing to participate in the program. We can improve outcomes for injured workers, and we think overall save the system more money by getting these injured workers back on the job sooner. We did have testimony in the Senate Banking and Insurance Committee. Our bill sponsor on the Senate side is Senator Jennifer Bradley from the Jacksonville area, so certainly appreciate her efforts. Representative Dan Daly is a bill sponsor on the House side. We had good testimony from an orthopedic surgeon in Tallahassee that talked about if he treats an injured worker in Georgia in one of their practice locations there to fix a wrist fracture, he gets paid $1,300. Here in Florida, it's $600. So it's glaring how the divide between the two states and how they treat injured workers and access to care is so glaring. So we were pleased the Senate committee passed it unanimously. Hopefully we get some movement going on the House side as well. There was no organized opposition on the Senate side in the hearing this week. So hopefully that continues. I'm sure it won't. I'm sure there are some people out there with concerns about it, but premiums in workers' comp have gone down 80% since 2003. And they're going down an additional 15% this year. So it's time, we think, to reinvest some of that savings into good quality access to care for injured workers.
Okay. And like you said, you can't predict anything in Tallahassee. It's a lot of question marks right now. The lawmakers are just getting settled in. Is there anything that we need to keep our eye on as far as the next week coming and the week after that, or what's on the horizon?
Yeah, to keep everybody on their toes, we only get alerted of bills being on committee schedules, usually 2 days in advance. So we do know to start of next week, they're going to talk about the ID card bill and the dispute resolution legislation. That's also been a priority bill for us as well. So hopefully next week when we get together, Joe, we'll be able to update everybody that we've made some positive progress there. So I think that's about it for this week, though. And Yeah, we'll keep an eye on other bills or add to the agenda next week.
Yeah. Well, Fraser, it's been a pleasure. And like we said, they're just getting started over there in Tallahassee. So we'll have a lot to talk about in the weeks to come, but I'm looking forward to it.
Absolutely. I hope you enjoy your weekend. It's playoff wildcard weekend. I feel sorry for those Jags fans out there, but hopefully for the rest of our Ducks in the state, they can enjoy some Florida-based football with the Dolphins and Bucks playing this week as well. And best of luck there.
Yep. Yep. I'm a Jaguars fan, so it was a tough end of the season, but congratulations to the Bucks and the Dolphins on making it.
Yeah, I had to give you a dig there, Joe.
All right. Have a good one, Fraser.
Yeah, thanks, Joe. See you next week.